When I was 8 years old, I was diagnosed with an autoimmune disease called HSP. And no, despite what Google might tell you, I wasn't suddenly labeled as a highly sensitive person. That's a completely different HSP. Mine involved mysterious purple rashes, joint pain, and hospital visits, not personality traits. At the time, I had no idea what was happening to my body, and neither did most of the adults around me. It was scary, confusing, and frankly not something you expect to deal with as a kid. But that experience led me to learn more about what HSP really is, and why understanding rare diseases like this matters more than we might think. First, we'll do a brief overview of HSP. Then, we'll go through the symptoms of HSP. Finally, we'll talk about the treatment and aftercare for HSP. Henoch-Schönlein purpura, or HSP, also called IgA vasculitis, is a rare autoimmune condition that causes inflammation in the small blood vessels throughout the body. It most commonly affects children between the ages of 2 and 11 and can also appear in teens and adults. According to the Mayo Clinic's article titled Henoch-Schönlein purpura, published in 2023, HSP is a form of vasculitis, which means inflammation of blood vessels. In this condition, the body's immune system mistakenly attacks its own small blood vessels, often after a respiratory infection like a cold or a strep throat. This immune response causes the buildup of a protein called immunoglobulin A, or IgA, which leads to inflammation and leaking in the blood vessel walls. Although the cause of HSP isn't fully understood, there are several known triggers. According to the Cleveland Clinic's 2023 article on Henoch-Schönlein purpura, possible causes include bacteria or viral infections, medications, vaccines, or even insect bites. However, in many cases, the disease seems to occur spontaneously without a clearly identifiable cause. HSP presents with 4 main symptoms. The most recognizable is a purplish rash called purpura, which typically appears on the legs, feet, and buttocks. As noted by the National Organization for Rare Disorders in their 2022 article, IgA vasculitis, this rash is caused by small blood vessels leaking under the skin and does not fade when pressed, which helps distinguish it from other rashes. The second common symptom is joint pain, or arthralgia, often affecting the knees and ankles. Swelling may also occur, but this typically resolves without long-term damage. The third symptom is abdominal pain, which can range from mild discomfort to severe cramping. According to Johns Hopkins Medicine's 2023 resource on HSP in children, inflammation in the intestinal blood vessels can also cause nausea, vomiting, and in some cases, blood and stool. Though rare, some individuals may experience serious complications such as intussuspension, or where the parts of the intestine folds into itself. The fourth and most serious symptom is kidney involvement. As explained in a 2022 article by the National Kidney Foundation titled IgA vasculitis, inflammation in the kidneys can cause blood or protein to appear in the urine, often with no obvious symptoms. While most kidney-related symptoms improve with time, a small number of patients may develop long-term kidney damage or chronic kidney disease. Diagnosis of HSP is usually based on clinical symptoms, especially the characteristic rash. To confirm and monitor the condition, doctors often perform blood tests, urine tests, and sometimes a biopsy. According to the Mayo Clinic, biopsies of the skin or kidneys may be done to detect IgA deposits, which help confirm the diagnosis when it's unclear. Treatment for HSP focuses on managing symptoms, since the disease often resolves on its own within a few weeks. As noted by the Cleveland Clinic, mild cases can usually be treated with rest, fluids, and over-the-counter medications like ibuprofen. In more serious cases, especially when kidney or gastrointestinal symptoms are involved, doctors may prescribe steroids like prednisone to reduce inflammation more quickly. Most people fully recover from HSP without lasting complications. However, Johns Hopkins Medicine points out that about 1/3 of patients may experience a recurrence of symptoms, typically milder than the first episode. Because of the risk of long-term kidney damage, patients are usually monitored for several months after symptoms go away. After my HSP diagnosis, I had continued hospital visits, constant medication, and was always moody or tired. Even though I was 8 years old, I was struggling mentally, and these hard times in my life truly show that you never know what someone is going through. Today, we talked about what HSP is. Then we talked about its symptoms, and finally, we talked about what the treatment and aftercare look like for HSP. In conclusion, Henoch-Schönlein purpura is rare but an important condition to recognize. It demonstrates how the immune system, which normally protects us, can sometimes become misdirected and cause harm. With proper recognition, supportive treatment, and careful monitoring, especially of the kidneys, most people with HSP recover completely. Just like me and my story, nobody is alone.